Hello, this is Dr. Ray Strand. I'm a family physician. I've been in private family practice in Rapid City, South Dakota now for over 35 years. I was trained at the University of Colorado Medical School, and when I was trained, I was taught that all you needed to do was eat a healthy diet and you did not need to take supplements. In fact, I was really told that all supplements ever did was create expensive urine, and that's what I taught my patients for 23 years. In fact, I did everything I could to get my patients off of nutritional supplements. And this is just the way I felt because it was the way I was trained. And so my feeling is that it is really a situation that changed with my wife. My wife, Elizabeth, we've been married now for over 30 years, but she suffers from a disease called chronic fatigue fibromyalgia. And when she met me and married a physician, she thought her health was going to improve. But nothing could be further from the truth. Year after year, her health got worse and worse. And in fact, in 1995, she came down with a serious pneumonia. And even though we're able to get her through that pneumonia, she was left with a serious chronic fatigue state. In fact, she couldn't get out of bed for more than 1 hour a day. Now, she's a horse trainer. And she trains and rides horses, but she couldn't even get out of bed. And it was at that time I had her see 4 different medical specialists who had placed her on 9 prescription medications. And even with that, it went on for month after month with no improvement. In fact, the specialist I referred her to could not give me any confidence that she was ever going to get better. Now, it was at that time someone brought over some nutritional supplements and said, hey, my husband got better with this, maybe you should try them. Well, my wife knew how I felt about supplements, and when I came home that evening from work, she really asked my permission if she could even take them. And I told her, you know, honey, you can do anything because what we're doing is not helping. I don't think there's anything more humbling than a physician who is not even able to help his own wife. She started those nutritional supplements, and to my amazement, within a week or two, she was definitely better. She was getting out of bed. Within a few weeks, she was off all her prescription medication. And within a few months, she was better than she had been in years. Now, this was obviously a shock to me. And I didn't know what had happened. And so I called in my 5 worst fibromyalgia patients. Now, we don't treat fibromyalgia. We just treat symptomatically. We might give them a non-steroidal anti-inflammatory pain medication, muscle relaxant. Usually we think they're depressed, so we give them some kind of antidepressant. Tell them to find a support group and learn to live with it. Well, I talked to these 5 fibromyalgia patients, and I said, I don't know what happened to my wife, but would you like to try what she did? Because she obviously, her health improved. Well, everyone agreed they wanted to try it. And they didn't have the miraculous improvement my wife did, but within a short period of time, at least within 6 months, every one of those patients had called and talked to me and said, Dr. Strand, thank you for letting me get my life back. This was really critical. And so this was something that I really was quite excited about. So I began to study the medical literature because this was not something I had ever been taught. I really was a traditional physician, and we as physicians spend most of our time treating critical advanced stages of disease. We are disease-oriented and we are drug-oriented. In fact, even what I have been calling preventive medicine was just early detection of disease. So when I'd have my patient come in for a complete physical and history, I'd do some lab work, check them. I was really looking for that silent disease. I was looking for that silent high blood pressure. I was looking for maybe the fact they're diabetic and didn't know it, or elevated cholesterol, maybe heart disease. If I did a PSA or pap smear or mammogram, I was looking for early cancers. But if I didn't find anything, I'd tap them on the shoulder and say, well, you're healthy, and out the door they went. But now that I've spent 17 years learning and understanding the health benefits of nutritional supplements, I really believe I've become that true healthcare expert I've always wanted to be because I've learned that the best way to fight off these chronic degenerative diseases is to equip the body and take nutritional supplementation. So that's what I'd like to share with you today. I want to talk to you about the health benefits of taking nutritional supplements. You see, my patients are not as interested anymore in the number of years in their life as they are the quality of life in those years. In other words, what good does it do for you to live to a ripe old age of 90 and have not been able to recognize your family, friends, or spouse for the last 10 years because you're suffering from Alzheimer's dementia? These chronic degenerative diseases not only end our lives, prematurely, but they cause us to suffer for years and years and years. So protecting the most valuable asset, your health, is really, I feel, a critical calling in my life. Now, when I studied the medical literature, I started to learn that even though oxygen was necessary for life itself, it also was inherently dangerous for my existence and our existence. You see, as we utilize oxygen within the battery or furnace of the cell, called the mitochondria, to create energy and life itself, occasionally there's a charged oxygen molecule that is created called a free radical. Now, a free radical has at least one unpaired electron in its outer orbit, and this gives it an electrical charge and very rapid movement. Now, if it's not readily neutralized by an antioxidant, it can go on to damage the cell wall, vessel wall, proteins, fat, and yes, even the DNA nucleus of the cell. So this is something that has been shown that we are basically rusting inside. So the same process that causes a cut apple to turn brown or rust metal is literally rusting us inside. Now, what I have learned and what the medical literature tells us, that this process is the root cause for over 100 chronic degenerative diseases. We call it oxidative stress, or this oxidation process. So diseases like heart disease, cancer, diabetes, Alzheimer's, Parkinson's, macular degeneration, MS, lupus, the root cause is this oxidative stress. Now, the best way I've explained this to my patients and when I'm out speaking is if you just are sitting there, imagine that you're at home watching a nice wood fireplace burn. Now, a wood fireplace burns nice for, 90-95% of the time, but occasionally there's a spark, and out comes a hot cinder and burns a hole in your carpet. Well, that's not really a big deal, but month after month, year after year, you end up with a pretty ratty carpet in front of your fireplace. So it's whatever, if you look at the fireplace as the furnace of your cell, and look at that spark as a free radical, and the carpet as your body, it just depends what part of your body wears out first is the type of disease you could possibly have. If it's your brain, you can end up with Parkinson's disease or Alzheimer's dementia. If it's your arteries, you could end up with a heart attack or stroke. If it's your eyes, you could develop macular degeneration or cataracts. If it's your joints, you could have arthritis or even rheumatoid arthritis. You see, that's what it's at, but we are not defenseless against this process. You see, antioxidants, which can neutralize those free radicals and render them harmless, is like the glass doors or the fine wire mesh you put up in front of your fireplace. Yes, the sparks are still going to fly, but your carpet, your body is protected. It's all about balance. You want to have enough antioxidants on board to handle the number of free radicals you're producing. But the number of free radicals you and I produce are not steady. There are many things that actually increase the number of free radicals you and I are producing. The most common one and the most noted one is cigarette smoke, and even secondary cigarette smoke. But the medications I prescribe, especially the chemotherapeutic drugs, create a tremendous amount of free radicals and oxidative stress. But sunlight, radiation, and the pollutants in our air, food, and water produce all these pollutants and heavy metals that build up in our bodies and increase the number of free radicals you and I produce. Now, if you're under mild or moderate stress, the number of free radicals you produce goes up just a little bit. But if you're under severe stress or chronic stress, the number of free radicals you produce goes up off the wall. So this really is the problem. So you want to have, again, enough antioxidants on board to handle the number of free radicals you produce. But this generation, we must deal with more free radicals than any previous generation in the history of the world. Are you winning the war within? Or are you coming into a doctor's office already rusted out like this picture on the right? You see, many people come into my office looking like this, rusted out inside. And then they say, "Doctor, save me." You know, but that's not where it is. This is why we want to fight this. We are not defenseless against this process. Antioxidants have the ability to render those free radicals harmless. So your antioxidant defense system can actually protect your body, much like a fresh coat of paint can protect your car, but balance is the key. You need to have more antioxidants available than the free radicals you're producing. So I had been telling my patients for 23 years that they just didn't need to take supplements. So I had to ask myself, and I was looking for the medical evidence that demanded a verdict, should my patients be taking nutritional supplements? But what I've learned as I've studied for the last 17 years, written all my books, is that our bodies are actually the best defense against developing any of these chronic degenerative diseases, not the drugs I can prescribe. We basically should all want to live as vibrant and the quality of life until we die. I have patients that come in, look like this Model T. They might be in their 70s, mid-80s, and they're active. They're still driving their car. They feel good. They have mental alertness and clarity, but they've taken care of themselves. They've been proactive in protecting their health, and that's what I've learned. I am reaching out to those individuals who want to be more proactive in protecting their health rather than being reactive after they've lost their health and run to the doctor and say, "Doctor, save me." And what is so sad is many of them find out, like Muhammad Ali or Michael J. Fox, who developed Parkinson's disease. Yes, we can maybe help them for a few years, but then the disease progresses, because by the time we diagnose Parkinson's in any patient, 80% of those brain cells involved are already gone. They've been destroyed. So we need to have a proactive lifestyle that protects our health. So I have now specialized in nutritional medicine. I believe that the way I practice nutritional medicine is totally different than how it's been practiced the last half century, because most nutritional practitioners focus on correcting what I call a nutritional deficiency. They might do muscle testing, iridology. They might do a hair sample, blood sample, urine sample, anything to try to figure out what you need a little more of or a little less of. However, as I've tried to share with you, the problem is not a nutritional deficiency. Our problem is oxidative stress. So what is the best way to help the body avoid what we call oxidative stress? Well, it is what I call cellular nutrition, or providing all of these essential nutrients to the cell and the body at these optimal or advanced levels that have been shown to provide a health benefit in our medical literature. Now, if you look at my books, I usually have I have two pages where I list all the essential nutrients and their optimal levels that I feel my patients or anybody that reads my book should be taking to best protect their health, or maybe regain it if they've already lost it. Well, this overwhelms people, but companies like RX have put these high-quality nutritionals together in two bottles, the vitamins and minerals called their optimals. And this provides the cellular nutrition that I recommend to all of my patients. In fact, they exceed my recommendations because they also contain that very potent grapeseed extract, another very potent antioxidant called resveratrol. It has other potent antioxidants, and these are above and beyond what I even normally recommend. They are very potent. In fact, they're the best provider of the cellular nutrition in the marketplace today, and I am thrilled to be associated with the RX family. But I want to explain to you what bothered me as a physician is that I was taught in medical school that really all you needed were RDA levels of nutritional supplements, or the recommended dietary allowance, or sometimes called RDIs. But you see, RDAs were developed in the late 1930s and early 1940s as that minimal amount of nutritional supplements that were needed to avoid what we call acute deficiency diseases like scurvy, rickets, or pellagra. RDA levels have absolutely nothing to do with chronic degenerative diseases. We need the optimal or advanced levels that are shown in the medical literature and studied for chronic degenerative diseases. Example would be the RDA of vitamin E is 30 international units. Well, you don't even begin to see a health benefit until you, in the medical literature, until you supplement over 100 IUs. And that health benefit seems to increase up until at least over 400 IUs. Well, go out and eat 400 IUs of vitamin E. You only need to get in 33 heads of spinach or 27 pounds of butter or 5 pounds of wheat germs each and every day to get that level of vitamin E. The RDA of vitamin C is 60 milligrams. Well, you don't see a health benefit in our medical literature till you get up over 1,000 milligrams. Well, you'd have to eat 18 large oranges or 80 avocados. Well, it became very obvious to me early on that the only way to achieve this is to be taking nutritional supplements. Now, the nutritional supplements or cellular nutrition that I recommend are the same nutrients we get from our foods, but at levels you can't obtain from your food. And so taking cellular nutrition is a superfood, but it also creates what we call synergy. You see, research is done on nutritional supplements by studying one nutrient at a time primarily. So they'll do a study on vitamin E, which we know is the most potent antioxidant within the cell membrane. Or then they do a study on vitamin C, which is the most potent antioxidant within the cell membrane, or within the plasma. Then they'll do one on glutathione, which is the most potent antioxidant within the cell itself. Well, what you learn is that vitamin E is not a drug. That's just how we do our research, but they work together. In fact, all these antioxidants need the so-called B cofactors, vitamin B1, 2, 6, 12, folic acid, to do their job in their enzymatic reactions. So they need these B cofactors at their optimal levels. They also need the so-called antioxidant minerals like selenium, magnesium, manganese, copper, zinc, and the list goes on and on. But what we find, and a lot of people don't realize, is that vitamin C can actually replenish vitamin E, so it can be used over and over and over again. Vitamin or alpha-lipoic acid, another potent antioxidant, can actually replenish the intracellular glutathione and that vitamin E, so it can be used over and over again. So 1 + 1 of these antioxidants is not 2, but it's 8, 10, or even 20. That is synergy. Well, when you're trying to bring oxidative stress back under control, I find by recommending cellular nutrition to all my patients, along with a healthy diet and a modest exercise program, I give my healthy patients the best chance to maintain their health. And this is what I am trying to accomplish, trying to protect their most valuable asset. But remember, cellular nutrition is not about disease, it is about health. Because the medical literature shows me that when you take this level of supplementation, you not only are able to optimize your body's natural antioxidant defense system, you can optimize your body's natural immune system and your natural repair system. So by taking cellular nutrition, you provide the nutrients at these optimal levels in a synergistic fashion can really optimize your body's natural defenses, and that is key. So when I looked at RX as a company, the first thing I wanted to know was the quality of their products, and that starts with the quality of manufacturing. And I was very impressed to find out RX manufactured their supplements in an FDA registered facility. This is key. But they also follow what we call pharmaceutical grade good manufacturing practices. You see, many of the companies that are out there that are producing follow no really any significant manufacturing practices. Some will follow what we call food grade good manufacturing practices, but that only requires them to have about 25-30% approximately what's on the label actually in their capsules or tablets. But if you're pharmaceutical grade, you not only have to purchase pharmaceutical grade raw products. In fact, RX will share where they get their raw products because they're the best in the world. But then you have to manufacture those products much like a pharmaceutical company manufactures drugs. In fact, RX's manufacturing facility also can manufacture over-the-counter drugs. They're OTC approved. That gives me even more confidence in the quality of their manufacturing. Now, it's also important that they meet what we call USP guidelines, or US Pharmacopoeia, for the quality and dissolution of their capsules. Now, what happens is that I always thought as a physician that, well, how all vitamins in their tablets dissolve. That's not true. When I was researching my first book, I found a study at the University of Maryland where they looked at 9 prescription prenatal vitamins, several produced by pharmaceutical companies. Now, they didn't look at what was in them. They just looked, did these tablets dissolve? In fact, one of the companies was one I had been recommending to my pregnant ladies. I did OB for 21 years. And what they found is only 3 of the 9 even dissolved. And the one I had been recommending, it was a Letterly product from Letterly Pharmaceuticals, did not dissolve. So it is very, very important to me now that the nutritional supplements I recommend meet these USP guidelines. But then, many companies will make claims, but then anybody can claim anything. But RX sends their products for third-party certification. It's called NSF certification to really show you and I that what they are claiming is actually true. So they're backing up their claims by third-party documentation, which I think is wonderful. So then I looked at their optimals because obviously my approach to nutritional medicine, RX's optimals, are my foundation. And I had set my standards in my books of what those should contain and the levels they should contain. Well, I was thrilled to find that RX optimals not only met, but they exceeded my standard. Like I said, they had 100 milligrams of this very expensive and potent grapeseed extract. They had another very important antioxidant called resveratrol, and 3 or 4 other very potent antioxidants that I didn't even have on my list because they're so expensive. So I was thrilled not only with their manufacturing process, but the quality and the completeness of their products. Now, I find that if my patients are in good health, most all they need are the RX optimals. And so I have all my patients eating a healthy diet, exercising, or at least recommending they do, and taking the RX optimals. But many patients come into me, they've already lost their health. They're suffering from one of these chronic degenerative diseases. It might be a disease like rheumatoid arthritis or cancer or macular degeneration, MS. But what I find in the medical literature shows me that my patients who are suffering from rheumatoid arthritis or Crohn's disease or that, they have more oxidative stress or free radicals than my patients who are in good health. Therefore, in order to bring their oxidative stress back under balance, or into balance, I need to add what I call RX's enhancers. And these are potent antioxidants that I add to the RX optimals. So what I find is that we need to look at the RX products, and so I can share with you. First of all, I have everybody on the RX optimals, the vitamins and minerals. But one of the first enhancers I use is Vanali, because they actually have the most potent grapeseed extract in the world today. They get it from Mendina, which is a family-owned business in Italy, where they have a Chardonnay grape that they've grown for generations. That is the absolute most potent grapeseed extract you can find. Not only is it pharmaceutical grade, but they check for 350 different toxins that could be found to make sure they're pure. And does this cost more money? Yes, it's about twice as expensive as the next best grapeseed extract, and it's probably twice as potent. But most companies only check for 50 of the pollutants. So what you'll find with grapeseed extract is that it's very potent, probably the most potent antioxidant in the marketplace today. And it is 50 times more potent than vitamin E, 20 times more potent than vitamin C. But it has some other very unique properties in the fact that it's a natural anti-inflammatory. So if my patients are really suffering from any inflammatory problem or joint problem or any inflammation, which many of my patients are, it's a wonderful enhancer to add to the optimals. But it's also an anti-allergen. I have so many patients that are suffering today from hay fever, asthma, allergies, and after being on the optimals and Venali, I have significant improvement in their health. There's a unique thing about Venali is the fact that it's a very small molecule, so it readily crosses over what we call the blood-brain barrier and concentrates around the fluid and around the brain and nerves and eyes. So I find it's a wonderful nutrient for any of my patients who might be suffering from eye problems or neurodegenerative diseases to try to bring oxidative stress back under control in that area of the body. So the next most important enhancer I use is BioPro-Q. Now, BioPro-Q is the most potent form of CoQ10. It's called the ubiquinol or active form of CoQ10. Every other company that I am aware of, especially in network marketing, uses what we call the ubiquinone form, which is the oxidized form. It's very fat soluble and very difficult to absorb. But then, even if you're able to absorb it, it has to be converted to this active ubiquinol form before it can be used by the body. Well, RX impressed me again because they said, we want the best CoQ10 in the marketplace today. So they went out and got the ubiquinol form, which is absorbed 8 to 10 times greater than this ubiquinone form. In fact, in my previous company that had the ubiquinone form, for me to get the blood levels that I desired in my patients who were suffering from neurodegenerative disease or heart failure or cancer, I had to use 10, 12, 15 of them. Well, most of my patients couldn't afford it, so I had to go to a ubiquinol form. Now I can go to RX's ubiquinol form to get that level because the ubiquinol form is absorbed 8 to 10 times greater. I can achieve those blood levels now in my patients with just 1 or 2 BioPro-Q. So the cost to my patients goes down significantly. Wonderful, wonderful enhancer. Well, another one that I use, Omega Q, is a wonderful, provides that omega-3 fatty acids that decreases inflammation in our body and contains CoQ10. Now, I use this more in my healthy patients that may have a strong family history, let's say, of heart disease, because then I recommend the Optimals and Omega Q. So that's where I use Omega Q, and that's because it has the CoQ10. You get the omega-3 and then all of the products in the Optimals. But Rejuvenex is a wonderful product. I have so many of my patients and people I know who are going to Starbucks every day and not only getting their coffee but adding extra shots, or they're taking their these energy boosters, or they might the 5-hour energy or Bolt, Jolt, or all of these energy drinks, which are loaded with caffeine and sugar, or they're going and getting a big gulp from their convenient food store. But Rejuvenex, this is the healthy energy choice. You can take 1 or 2 Rejuvenex, and it contains that natural coffee or caffeine from the green coffee bean that has a wonderful natural products that actually help you control blood sugars better. But it also has these superfruits, the noni and the acai berry, all of mangosteen, all of these wonderful superfruits that are additional antioxidants and are really great enhancers. But it creates a healthy alertness and focus. Plus it has a balancer because it has L-theanine and kava, which is calming. So you don't have the highs or lows of the energy drinks. You won't have that big drop and that really crash in the middle of the afternoon. It prevents that, but you still have that alertness. That's what's wonderful. Now, I am thrilled with RX's newest product, RestoreX, and I just want to talk a minute. I'm going to be doing these webinars twice a month. Normally it's the second and fourth Tuesdays of every month. Now, I will not be doing one at the end of March because at the end of March, I'm actually going to be speaking in Mexico for RX, and I will not be able to do it. So on the 13th of April, I am going to do my next webinar, and I'm going to talk to you all about RestoreX. But let me just share with you just some simple things about it. This is really a detox center in a bottle. You see, I talked to you about all these heavy metals and toxins that we have, increasing the amount of free radicals you're producing and creating more free radicals you've got to neutralize. Well, RestoreX actually has chlorella and a patented form of zeolite that actually has received a medical device patent in Europe. This comes out of Austria, this zeolite. But the chlorella and the zeolite actually bind these heavy metals in the GI tract where they tend to congregate and hold on to them and get them out of the body. And the toxins. So the only other option I ever had with my patients to detox was to go to a detox center and spend 7 to 10 days at a cost of $10,000 to $15,000. Well, most of my patients couldn't even afford that. But now I can do a detox at home using RestoreX. Plus, it has other very fine nutrients that not only the chlorella and spirulina, activated charcoal, and just wonderful nutrients that not only detox you, take out the toxins and heavy metals, but also alkalinizes the body by partly taking out those acidic heavy metals, but also restoring the GI tract, healing the GI tract, and creating an alkaline pH, which we know all of us are too acidic. So I'm excited about this product. It's the other side of oxidative stress. It's the other side of the coin. You know, yes, we take these antioxidants to build up our natural body's antioxidant defense system, but now we can use RestoreX to detox the body so that our bodies are going to make less free radicals, so we have fewer that we have to neutralize with our antioxidants. So it's going to bring oxidative stress back under balance in a different fashion. Well, needless to say, I am very excited to be part of the RX family. But what I have learned in my medical practice over the years is not written in any medical books or texts. This is just my clinical experience. And I would encourage all RX members just to check out my website, healthconceptsint.com/RX. All RX members receive their first month free access to my website. Not only do I have wonderful articles and blogs sharing with you the health benefits that you can receive by taking nutritional supplements. I have videos. I have many things to teach and educate that you can share with your family and friends. But also, I give my specific recommendations, nutritional recommendations for more than 100 medical conditions. And this is through my medical membership. Now, there is a Google translator that we've installed on this, so you can select your language. If you've got some people in China or different areas, my books have been translated now. My What Your Doctor Doesn't Know has been translated now in 18 different languages. So I'm getting consults from many different languages. But there's another feature here I think you'll be really excited about. My members have a feature. It's called Ask the Expert. Well, I'm obviously one of the experts, so you can ask me a question that you can't find answered on the website, and I'm not going to guarantee I'm going to answer every question that comes to me, but I'm going to look at everyone, and I'm going to review them, and if I feel they have a general interest, I will answer that, and then I will put it in our database that's searchable so that you can find these answers, and over time, we are going to have a resource here for you to help you. You can rely on my expertise. You can share it to help people with their health, and obviously that's my real heartthrob, because I want to become that true healthcare expert that you can trust. That's why I've spent so much time in the medical literature. I document everything that I do, and I would just encourage you to go ahead and register today for your free medical membership at healthconceptsint.com/RX, and we'll show you how you get that free month. If you're not happy with it, there's no risk you take, and just cancel before the end of the month and you'll be charged nothing. Now, it's only $9.95 to have that membership, and you'll find it's a wonderful tool for yourself personally, for your family. And I allow my members to share my recommendations or arrange a consult for their family, friends, and associates. So take advantage. Take a look at that. It will answer a lot of your questions. And I hope I can help you spread this message of health, and that's what I want to share. I want to end. Many people wonder, what is the role of nutritional supplements? As a physician, I have learned that all my patients need to be on nutritional supplements. However, many of my doctor friends still come up to me and say, Ray, why in the world do you recommend vitamins to your patients? Well, I'll answer that question by asking them, well, have you ever recommended exercise to yours? And they say, well, of course we do. And they'll say, well, why do you do that? And they'll say, well, I feel my patients who have a modest, consistent exercise program have a health benefit over those that don't. And I'll tell them, what do you base that on? He says, well, we base that on the medical literature. And so I'll ask them, well, so if you're recommending exercise to your patients, are you treating a disease then? And they say, of course not. Well, I could say the same thing about a healthy diet. There's a health benefit for eating a healthy diet. But see, that's what I have learned. By studying the medical literature, I realize that there's a health benefit in taking nutritional supplements. My patients who take high-quality, complete and balanced nutritional supplements like the RX Optimals and their enhancers have a health benefit over my patients who don't. Am I treating a disease then when I recommend these nutritional supplements? Absolutely not. All I'm trying to do is build up the body's natural defenses, because I realize that's the best defense against these chronic degenerative diseases and bringing oxidative stress back under control. That's my goal. So I want to thank you for joining this webinar. We're going to record this. It'll be up for you to view 24/7, and I'll be back with you again on April 13th, and I'll talk to you all about Restorex. So thank you for joining me. Appreciate your time, and we will be seeing you later, and hopefully